Yeah, another longtime healthcare watcher, former administrator for the Center for Medicare and Medicaid Services. So the president had two goals when he set out here: expand coverage and reduced costs. We know from these estimates 94% of Americans will be covered in this bill. Does it reduce cost?
Depends on whose perspective you're looking at. In terms of costs for people who don't have access to good coverage now, costs are going to come down, especially for low and moderate income Americans. However, overall healthcare spending is probably going to go up a little bit. That's despite a lot of effort in this bill to bring down costs in Medicare and to make our healthcare system work more efficiently. That's mainly due to the expansions of coverage that are giving more people subsidized insurance, and that's going to probably increase costs.
There are a couple of things that I want to point out in this book, because I know you were watching them. Some of the ways that this bill is funded, which are fees on insurers, device makers, drug makers, they got a little bit of a break in the Senate version. You had to be watching closely this weekend to see this happen. Explain.
They got a little bit of a break, especially in the early years. So these fees help finance the bill, and they've come down a bit, both the fees on insurers and device manufacturers. There's also some of the payment reductions that are scheduled for hospitals and other healthcare providers, but those do increase in the later years of the program, and that's really the big challenge. In order for this bill to work in the long term, we're going to have to take the provisions in the bill that are expected to lead to reductions in healthcare spending or in the Medicare program of about 2% per year and make that work. So far, the American public has been pretty nervous about any ideas that would save money if they think it might have an effect on their access to health care and their access to new cures. Working all that out is the biggest challenge in implementing this legislation.
They've been nervous, but people who've been watching the healthcare sector don't seem to have been. We've seen healthcare stocks, particularly managed care stocks, really shoot up.
Yeah.
There's no public option here. There is an individual mandate. Is this a win for private insurers?
And healthcare spending overall is likely to increase. Yeah. So I think it is a win, especially for companies that are in this already and are kind of used to the market. Where things may be a little bit difficult is for companies that are trying to reform the way healthcare works. For example, there's a new limit on so-called medical loss ratios. That's how much health insurers can spend on things other than directly paying healthcare providers. What a lot of health insurers are trying to do now is give people personal health records, promote wellness programs, coordinate care, do things that aren't really traditional healthcare spending. And hopefully, when this law is implemented, it'll be done in a way that enables those kinds of programs to expand, because they really could save money.